Hello everyone. Today I'm going to teach you the male catheterization. It is very important skill that you need from the examination point of view as well as from the clinical point of view. You may see many patients coming with the urinary problems. You may need the monitoring of the patient when you are treating the patient for sepsis, and many of the time the patients may require catheterization as a part of their post-op recovery. So this is very important skill. The important thing about this is it has to be sterile. There are few things that you need to consider before you catheterize a patient. Always check the allergies, especially the latex allergy, because catheter is made of latex. If the patient is allergic to latex, you will need to choose silicone catheter. Then also make sure that you explain the procedure to the patient. Say for example, if the patient comes with the urinary obstruction, make sure that you explain why you need it and what's the benefit of having the catheter. And before you perform the catheterization, it is important that you know the residual volume of the urine by performing a bladder scan. Before we continue forward, I just want to introduce myself. I'm Dr. Rashid and I'm the PLAB guide trainer. I'm going to show you all the steps from the start till the end of the catheterization. The first thing that you want to do is explain the procedure to the patient, then gain the verbal consent which is enough for such procedure. Because this is an intimate examination of the procedure, it is important that you get the chaperone and maintain the patient's privacy as well. Patient should understand that you will need access to the genital area, to the private area, and you will need exposure for that. So explain the procedure, gain the consent, and gain the exposure that is below their waist. Then the next thing that you want to do is collect all the material. So let's start. So we need the catheter pack, and we need a catheter. We need instiller gel that is usually packed, and we will need 2 pairs of gloves. So for this procedure we need 2 pairs of gloves. They should be sterile. I will tell you when to change. At the moment, for the sake of this video, I'm using 1 pair, but I will tell you where to change the next pair of the gloves. The patient has to be lying on their back with their both thighs apart. After you've explained, the patient has made the position, and then you prepare your material. We have the urine bag as well. You prepare your material. This should go in the clinical waste. Make sure that you wear the non-sterile gloves when you are preparing the trolley and making your sterile field. Now when you open this, you will see a kidney tray and a sheet to drape the patient, and a few gauzes and a few balls of the gauze. These are to clean. Then you open the catheter, the outer packet on here. It is normally covered with an outer packet as well. I have taken that out just for the sake of this video. And you have the urine bag ready, and now I'm ready to catheterize the patient. And before I do that, I'm going to use 1 pair for the sake of this video. However, you need to make sure that you mention that you will need 2 pairs of gloves. Okay, so now we are ready. So wearing my sterile gloves, I need to get access. The patient is prepared, ready to have the catheter. This is the port for the solution to clean. In your examination, you may get just an empty pot labeled with the sterile water to clean. Now the next thing what I want to do is make sure that you drape the patient. You may get a sheet like this with no hole, or there may be a sheet with the hole in the center. If there is no hole, you can make a hole in the center so that you can put on the patient. Put it like this, making sure that you do not touch the non-sterile area of the patient at all. The next thing that you want to do is throw this on the penis and hold it and clean the tip of the penis 3 times, moving away from the meatus. And we should clean it in a circular fashion. This goes in the clinical waste. Clean it again, moving away from the meatus, and clean it properly. At no point you should be touching the penis directly without holding the gauze in the middle. Clean it at least for 3 times. We have the instiller gel now. The penis is now cleaned. The next thing that you need to do is insert the instiller gel. Warn the patient at this point that the patient may feel a bit of discomfort. However, the use of this is to lubricate as well as numb so that the patient does not feel the pain. Inject the instiller gel and pinch it at the bottom so that gel remains inside. You can use the shaft of the penis, the shaft of the syringe to squeeze it in. And this goes in the clinical waste. Now this is a point when you have to remove the top layer of the gloves. Mention this to the examiner or verbalize it that ideally I will change the gloves at this point, because the reason behind that is the catheter is a prosthetic device that you are going to insert the patient in, and it is important that you change your gloves before you insert any prosthetic device. Now if you look on the catheter, it has a piercing on the front as well as on the other end. At no point, even if you have changed your gloves, even if those are new gloves, you need to make sure that you do not touch the tip of the catheter at all. Hold it from one end and pull it apart so that it rips off. And now you can see the tip of the catheter comes out. Okay, hold the catheter from the covering outside and insert it. Warn the patient again, insert it gently, and then you pinch it to hold the catheter in the penis and slide the covering back. Pinch the covering to hold the catheter, insert it, slide the covering back, pinch the catheter again with the covering outside, insert and slide it back. So this way you continue till you reach the Y junction. At no point you should touch the catheter directly with your gloves, even if they are sterile. Hold pinch, insert, slide it back, pinch, insert, slide it back, pinch, insert, and continue doing that till you reach the Y junction. At this point, normally in a patient, we should expect the urine to come out. For the sake of your examination, it may not be connected to the water tank and you may not get the urine. You can ask the examiner. Then the next thing that usually comes in the packet is a saline for flush. After you've seen the urine coming out, push the flush in so that it remains inside. And now, after you've seen the urine coming out, connect it to the patient, to the catheter, and then you clean all your waste and throw in the waste bin. That's all about it. After you've done this, go and document the procedure in the patient's notes and make sure that you also send a urine sample to the laboratory for the microscopy and culture sensitivity. Thank you.